When children need medical care, they have unique requirements. And at Sacred Heart Medical Center, we have dedicated pediatric subspecialists to treat our smaller and younger patients.
So I've been at PeaceHealth now for a little under 2 years, and it's been my goal to increase the number of services that we offer to children at PeaceHealth. Currently, we have 2 full-time pediatric surgeons who work at PeaceHealth. Myself and my partner, Dr. Ruscher. We have a full-time pediatric cardiologist. We have several pediatric anesthesiologists. We have a number of pediatric hospitalists. We have pediatric trained nurses. We have neonatologists. We have neonatal trained nurses. There's a number of services that we have to provide care for the children in the community.
When it comes to surgical procedures involving infants and kids, having surgeons specializing in pediatrics is invaluable.
Most of the problems that kids have are problems that they were either born with or infectious problems that are different than what adults have. And so learning how to manage these problems, how to take care of them, how to recognize them, and how to treat them effectively takes a whole different kind of surgeon than the adult surgeon.
We are some of the only surgeons who can really operate on almost any part of the body. That's something that it's such a blessing that I was able to undertake that training, and it's even greater when I know that I can use that to help children.
Many of the congenital anomalies are rare problems. Some of them you may see only once or twice in your career. And so unless you're at a center that does a lot of pediatric surgery, such as this one, you're not going to get the experience to take care of these problems. And so they'll be unfamiliar to the surgeon who's encountering them. It's important to know how to take care of families. You're not just taking care of the child, so understanding the dynamics that go along with taking care of the problems, not just in the operating room, but before surgery, after surgery. These all take experience and expertise that the adult surgeon may not have experience with because they're not used to dealing with young kids and with families and with parents.
Pediatric cardiology is another specialized area of medicine now available for our young patients.
Basically, a pediatric cardiologist takes care of children who have heart conditions, and that can be a variety of heart conditions. Most commonly, patients have congenital heart disease, meaning they were born with a heart condition. It can be a problem with a heart valve or a hole in the heart. But basically, a pediatric cardiologist will make the diagnosis based on interpreting diagnostic studies, such as an echocardiogram. They manage patients until they may or may not need any type of intervention, such as a heart surgery. And then after they've had that intervention, they'll continue to manage those patients, sometimes for their entire life.
An important role in pediatric subspecialty care is the pediatric anesthesiologist for surgery as well as for diagnostic testing requiring very still patients.
Having somebody who's experienced putting babies to sleep, waking babies up, dealing with families, dealing with scared children is often more important than what I do. And so having good quality pediatric anesthesiologists is one of the highest priorities for me at a hospital. I wouldn't work at a hospital that didn't have good pediatric anesthesia. Hospitals are very stressful places, and so we try to create an environment that is less stressful for them. We have a recovery room where an area that's just for the kids, so the families and parents can come in and be with their children as soon as they're recovered from their anesthesia. So again, it's creating a culture of family, not just a hospital and a patient.
We have a large number of patients, and many of those patients live in Eugene or the Mid-Willamette Valley, Southern Oregon, places that are quite far from Portland, and often Portland's an intimidating place to go for those patients.
Your resources, your family support, your friends, all those are close to home. And so if we can provide good care for these children closer to home, it's better for the children, it's better for the families, it's better for follow-up. We just know that they're going to get better care if it's done locally.
Specialized pediatric care for our extra special patients, our children.
It's nice seeing them after they've recovered from their heart surgery or procedure and watch them grow up and thrive and really be very normal children and adolescents.
There's such a difference when you walk into a child's room and you see that they're unwell, they're not talking, you can tell from their vital signs they're not well. But then when you do a procedure or a surgery or some kind of treatment and they're getting better, and a couple days later you walk in their room and they're playing a card game and they want you to play with them and you know that they're better, there's nothing like that in medicine to me.